Okay, my name is Megan Jones. Student number is 9693T, and this is practical number 1 assessment for nutritional patient assessment.
I, Ben Figgins, on this day, the 22nd of August 2014, agreed to the inclusion of my contribution to this DVD/video assessment, the nature of which has been explained to me. I understand that my contribution will be viewed by an assessor at a college for the purpose of assessment and marking. I'm over 18 and have agreed to be part of this DVD/video assessment on a voluntary basis. I understand that this DVD/video assessment or part of it may be used for the purpose of further review at the college or used in moderation for validation processes. I understand and agree that my personal details and this DVD/video assessment will be stored and archived in accordance with the college policy and procedure. I've read and understood the college privacy policy and procedure found at the website.
Okay, thank you. Okay, so my name's Megan and I'm your nutritional consultant for today. What was your name?
My name's Ben.
Hi, Ben. So, what brought you here today? Can you describe a little bit about basically the reasons or symptoms that you might have?
Well, I have bad hay fever, and it often makes I sneeze a lot, and I get itchy eyes, and sometimes it's really hard to concentrate or work or go to sleep because of it.
Yep. Okay. So, do you want to describe to me where exactly you experience these symptoms mostly?
Well, it depends. If it's in spring, usually outside, or if it's windy outside.
What about in your actual body? Whereabouts you get the symptoms?
Oh, okay. Around my nose and my eyes, itchy eyes, and runny nose.
Sorry, a runny nose.
Runny nose.
Yep.
And sneezing. Yeah.
Okay. And then what would be the triggers, do you think, for these symptoms?
The triggers would be different types of pollens, windy days, dust, cat or dog hair.
Yep.
And things like mould, that sort of thing, and stress as well sometimes.
Okay. And what would you say the duration would be of the symptoms?
It depends. It depends. If it's really bad, it might be all day. If it's not bad, it just might be a short episode, a couple of minutes.
Okay. And how often do you experience the symptoms?
Depends on what time of year it is or how bad the environment is.
So, do you want to sort of describe further what happens at different times in the year?
Well, if it's spring or if it's windy around that time of year and there's pollen, then it's every day.
Okay.
But then if it's winter or something, it may not be at all unless there's something to trigger it.
And if it wasn't spring and it was triggered during the other part of the year, how long do you think that symptoms would last for?
Well, it might be just sneezing for a couple of minutes, but usually 10 or 15 minutes.
Okay.
Yeah.
And then what would you say the factors are that make the symptoms dissipate a little, or make them better?
What makes them better? Just a clean house. Mostly just clean and tidy house that's not dusty. Not going out on windy days, or if there's lots of pollen out. In spring.
And in spring, on a scale of 1 to 10, 1 being not so bad at all and 10 being unbearable, how would you rate the symptoms?
It's usually between 7 and 8.
7 and 8 in spring. Okay. Okay, so when do you think these symptoms started to happen? How old do you think you were?
How old was I? Oh, I don't know. I can't remember.
You can't remember?
No.
Would you have been...
It would have been all my life, though,
Okay.
as far as I remember. Yeah.
So, from
It's
as early as you can
hereditary.
remember.
So.
Sorry?
Yeah, it's hereditary, so Dad has it really badly as well.
Anyone else in your family?
Hugh. Yeah, my brother.
Brother?
One does and one doesn't.
Brother. How about your mum?
No.
Okay. So I'll say you've had it for as long as you can remember.
Yeah.
And does it happen every year?
Yeah.
Every spring and throughout the year as well, every year?
Yeah.
Has it been getting progressively worse as you've gotten older?
Well, it's always been pretty bad.
Mm-hmm. Okay, we're just going to move through the body systems just to see if there are any other symptoms that might pop up when we run through them. So, with your digestive system, do you ever get any ulcers, bleeding gums, or bad breath?
It's not really. I mean, I might get bleeding gums if I brush my teeth hard, but that's pretty normal, I think.
Yeah. Okay. Do you generally have a good sense of taste?
Yeah.
Do you ever get cracked lips or teeth problems?
No, not really.
No. Have you had any fillings?
Yeah.
How many?
Oh, I don't know. Probably about 6 or 7.
6 or 7, yeah. Okay, so with your upper digestion, is your hunger generally pretty regular?
Yeah.
Yeah. Do you ever get any heartburn, indigestion, burping, belching, or nausea?
Not really. Not much. I mean, if I eat too quick, I might get a bit of reflux, but that's unusual.
Do you ever get any bloating, vomiting, or vomiting?
I get a bit of bloating sometimes.
Yep. Is there a general pattern with that?
No, I mean it's just if I eat too fast or I eat crappy. Well, not crappy, but if I eat food that's not very good.
Okay. Do you mean not very nutritious? Or?
Yeah, like fatty food.
Okay.
Yeah.
Now, with your lower digestion, do you ever get flatulence, constipation, or diarrhea?
A little bit of flatulence sometimes.
Mm-hmm.
Yeah.
Have you ever had hemorrhoids?
Once.
Once. How old were you?
32.
Mm-hmm. So about nine years ago. Cramping, bloating, or any pain?
Sometimes bloating.
Mm-hmm. You did say that too. That was from the food. Okay. Have you ever had any jaundice or hepatitis?
No.
Okay. So for your bowel habits, how often would you go to the toilet?
Once or twice a day.
Can you describe for me the colour or the type, whether they float, sink to the bottom?
Well, yeah, I mean they're usually brown, light brown or brown, and they usually sort of, I guess, sink to the. I mean, I don't know if they sink or float, but I think they sink. Yeah.
Mm-hmm. Do you ever get any pain or cramping?
No.
No. Any mucus blood, diarrhea, or constipation?
No.
Do they generally smell the same all the time?
Yeah.
Yeah. Is there ever any undigested food in them?
No. Only if I've had nuts or something. Yeah, like bits of nuts or whatever. Yeah.
Okay, so for your cardiovascular system, starting with the heart, have you ever had any high blood pressure?
High blood pressure.
No?
No.
Ever had any chest pain?
not really, no.
No. Any heart palpitations?
Yeah. After too much coffee or whatever.
Just after too much coffee?
Or if I get really stressed, yeah.
Have you ever had any conditions of the heart, like dysrhythmia, angina, any dizziness on standing?
I had a little bit of angina at one stage and sort of dizziness, but that wasn't on standing. That was just in general.
How old were you?
I was just when I was probably early 30s, but it was stress related.
Stress related. Was that diagnosed by a doctor?
Yeah.
Were you on medication?
No, but I thought I needed to get medication, but she said it was just stress.
Okay. Have you ever had experienced pain in the heart on exercising or?
No.
No. Fainting?
No.
Any swelling in the legs?
No.
Okay, so for your general circulation, do you have cold hands or feet?
No.
No. Any fluid retention?
No.
Swollen ankles?
No.
Numbness or tingling?
No.
Varicose or spider veins?
I don't think so. No.
Hot flushes?
Not really. No.
Leg cramps?
No.
Okay, so for your respiratory system, with your upper respiratory system and your nose, have you ever experienced sinusitis?
Yes.
Okay. How often?
When my hay fever was really bad. Yeah.
So it's associated with the hay fever?
Yeah.
Okay. Colds?
Cold, yeah, I get so not very often, but if I do, they can be pretty bad, yeah.
Nosebleeds?
No.
Nasal stuffiness?
Yeah.
Okay. Now with your chest, have you ever had asthma?
No.
Any wheezing?
No.
Shortness of breath?
Not really, no.
Mucus?
No.
Cough?
Sometimes in the morning, yeah, I'll have a bit of a cough.
Is that generally when you've got hay fever as well, or is it?
No, I just cough sometimes. I don't know why.
What type of cough is it?
Just a normal cough.
So is it raspy or wheezy?
No,
Or?
well, it's not raspy or wheezy, but it's just like a normal, like clearing the throat cough.
Okay.
It's probably just clearing my throat after I clean my teeth. I'm not sure.
Okay. Have you ever had bronchitis or pneumonia, emphysema?
No.
Or pleurisy or tuberculosis?
No.
Okay, so with your nervous system, with regards to your head, do you experience headaches or migraines?
No, not generally.
No. Tension?
Only my neck.
Okay, so neck pain. What type of pain is it?
Just stiffness.
Yep. Does it radiate anywhere?
No, just maybe to my shoulders sometimes.
Yep. And how often do you get that?
Probably once a month.
Once a month. Do you ever get vertigo or dizziness?
Not really. I mean, I have maybe every so often if I'm really, really tired.
Mm-hmm.
I've had a little bit of dizziness, but
What
it's
happens
pretty
with
rare.
the dizziness?
I just feel a bit faint. That's all. Like I'm gonna, like the room just moves a bit, and like I'm gonna pass out. But I know that I'm not going to. It just feels weird. Yeah.
Do you know what that's from?
Usually if I'm exhausted. Yeah.
Okay. Anything else?
No.
Okay. So, with your eyes, do you wear glasses or contacts?
Yeah, wear glasses.
Are you short or long-sighted or anything else?
Short-sighted.
Short-sighted. Do your eyes ever get tired or sore?
Yeah.
Yep. Do they get tired or sore generally?
They get a bit sore. Yeah.
Is that every day?
They get a bit itchy and sore from hay fever, but they get sore also from the computer and fluorescent lights as well.
Yep.
Or just bright lights in general.
Mm-hmm. Do they get watery?
Not really, unless I've got hay fever.
Okay. Do you get redness or itching at all?
Yeah, sometimes with the hay fever, yeah.
Okay. Do you get double vision?
No.
Blurred vision?
Not really. I mean, only distant things.
Okay. Have you ever had glaucoma or cataracts?
No.
Okay. So with your ears, do you ever get ear infections?
No.
Deafness?
Not really, no.
No
I mean, my left ear's not as good as my right ear.
Okay. And do you know what that's from?
That was an accident when I was about 14. I fell through a roof and it's on one side of my head. I landed really hard, so...
Okay. So that was trauma related.
Yeah.
Okay. Do you ever get any discharge from your ears?
No.
Do you have tinnitus or ringing?
Yeah.
Can you describe
Just
that
in
for
my
me?
left ear. Yeah, mostly my left ear.
Okay. Is it every day or
That's all the time.
all the time?
Yeah.
Okay. And is it the same level constantly all the time?
No, it's aggravated by stress, lack of sleep, coffee, alcohol, salt, and a repeated exposure to any type of noise.
Okay. Alrighty. So for your neurological part of the nervous system,
Yeah.
do you ever get any blackouts or seizures?
No.
Paralysis?
No.
Loss of sensation?
No.
Any tremors or dizziness apart from what you mentioned?
No, not really.
Okay. Now for your skin, would you describe it as dry or oily?
No, it can be dry if I've got bad hay fever. My scalp gets dry.
Okay, from hay fever. Dry scalp. Do you ever experience pimples or acne?
Not really.
Do you ever have psoriasis, eczema, or dermatitis?
No.
No? Have you ever had any fungal infections?
Have I had any fungal infections? I've had jock, itch or
Jock
whatever
itch?
it is. Yeah. That was from sport.
From sport? Yep. How old were you?
It was last year.
Last year. Okay.
40.
Okay. Do you ever get cold sores?
No.
No. Alopecia?
What's that?
Thinning of the hair or hair falling out.
Hair falling out? Not generally.
No. Is your hair greying at all?
Yeah.
Yep. When did that start?
2 years ago.
Yeah. Okay. So, just moving on to your endocrine system. Have you ever had any issues with your thyroid?
No.
So, you don't get any extreme heat or extreme cold sensations?
No.
Or sweating?
No.
Diabetes?
No.
No. Any low blood sugar or weight gain or weight loss?
Not really, no.
No. Do you get any fatigue at all?
Not really, no.
No.
If I mean, only just due to lack of sleep, but that's
Okay.
it. Yeah.
Okay. Have you ever had any issues with your urinary system?
No.
So no pain or burning or incontinence or anything like that?
No.
Okay. Now for your muscular and skeletal system, have you ever had any injuries?
Yeah.
So you mentioned the head trauma before.
Yeah, so I had a head fracture.
It was a fracture, was it?
Yeah. And I've had...
and so you were hospitalised?
Yeah. And broken collarbone.
How long did the fracture take to heal?
I'm not sure how long it took to heal, like 6 weeks or something.
Okay. Okay, so head trauma. And sorry, the second injury you mentioned? Collarbone. Was that in the same accident?
Yeah.
Was that about the same healing period as well?
Yeah, I think so. I can't remember.
Okay. Do you have any regular pain?
Not generally. I mean, no. I mean, I just get a sore neck from time to time.
Mm-hmm.
And the tinnitus can become irritable.
Mm-hmm.
I'll get a clenchy jaw.
Yep.
Sometimes I'm not sure what that's from.
So you don't have any idea what might be the onset for that?
No, not really. It's getting worse.
Mm-hmm.
Not sure why.
Is it stress related as well, or?
Yeah, it can be stress related, but sometimes I'm just doing it involuntarily. There's a word for it. I can't remember what it is.
You ever had any broken bones apart from what you mentioned?
No.
Or arthritis, cramps?
No.
Okay. Okay, so with regards to your immune system, do you get many infections?
No.
Okay, no. Any issues with your glands?
Glands. Oh, I mean, I used to get glandular fever when I was a kid a lot.
A lot?
Yeah.
How many times do you think you got it?
Oh, almost every year.
Really? Okay.
Yeah.
And how did you recover from that?
What do you mean?
How did you get over it?
Well, I just rested.
You rested?
Yeah.
Do you know how long you rested for each time?
Well, a couple of days.
Okay. Okay. So, with your reproductive system, do you have any prostate problems?
Well, not that I know of.
No. Any infections, discharges, STDs?
No.
Any painful or interrupted urination?
No.
Do you use STD protection?
No.
Contraception?
Not really.
And your libido? So it's
High.
high. And you're sexually active?
Yes.
Okay. Okay, so just going on to your medical history from the past, you mentioned that you had glandular as a child.
Yep.
And then you had hay fever, you think, as well as a child.
Yes.
Did you have any other allergies, measles, mumps, or anything like that when you were a child?
I don't. I had like something like chicken pox, but that's
Something like it, so it wasn't exactly chicken
yeah.
pox.
We weren't sure.
Oh, okay. Were you hospitalised or anything like that?
No.
Antibiotics or anything? Or
No.
no. Okay. Have you been vaccinated for measles, smallpox, mumps, tetanus, rubella, polio, flu, and hepatitis B?
Some of those things. Which
So
ones?
measles,
Yes.
smallpox,
Yes.
mumps,
I can't remember.
tetanus,
Yes.
rubella,
No.
polio.
I probably would have when I was a kid, but I don't know.
Yep.
For sure.
Flu,
No.
hepatitis B.
Yes.
Did you travel anywhere overseas where you got vaccinated before you left?
Yeah.
Where was that?
Bali.
Yeah, and what vaccinations did you get?
Hepatitis B and typhoid, I think.
Okay. Okay, so for adult conditions...
Oh, what's the one that you get from the monkeys?
Tetanus?
No, there's like a flu that you get from them. I think it's typhoid anyway. It was that, whatever it was.
Okay. Now, as far as adult illnesses go, basically the same. So hay fever. Have you ever? You said you didn't have hypertension. You've never had hepatitis, HIV. Any mental health issues?
Just sometimes stress, a bit of depression for a while.
When was the last time you had depression?
Probably. I mean, every now and again, probably every month, really.
Every month.
Yeah, get a bit depressed, but that's just.
Would you say it's serious depression?
No.
Does it affect your day-to-day life at all?
Well, it can, yeah, but
What can it affect?
Well, just my interaction with people and.
Does it stop you from doing things?
Yep.
What does it stop you from doing?
Socialising with people. And just less motivated, and I don't have any attention span, lack of attention span from it.
Yeah. Have you had any operations apart from the one that you mentioned when you had the accident?
No.
Okay.
I mean, I've had plastic surgery on my face, but that was after an accident. Yeah.
After the same accident?
Different one.
Oh, okay.
I'm a fairly accident-prone kid.
How old were you when you had the plastic surgery?
5.
How often do you use antibiotics?
Very rarely, once every couple of years.
Okay.
Maybe the most.
Just for the flu?
Flu.
Yep. So, do you remember the last time you had them?
When I had them. When I had a really bad cold and I just wanted to get rid of it. Yeah.
Do you remember when that was?
And I had it for something else. Yeah, no, for the flu. I know I've had it for the flu,
Do
but
you remember when that was?
last year.
Last year. Do you always finish the course?
No.
No. Now, do you have any other health practitioners, for example, chiro, osteo, physio, kinesiologist, acupuncturist?
Just osteo.
Just the osteo. Have you had any blood tests lately?
Yeah.
What were they for?
Last year.
For everything?
Just a STD and general health.
Yeah.
One.
Were they all okay?
Yeah.
Okay. Now, for your family medical history, has your mother ever had any illnesses?
Yes.
What did she have? What does she have?
She has ovarian cancer.
Okay, and so she's in remission at the moment?
She passed away.
Okay, when did she pass away?
Last year in August.
August last year.
And she suffered from severe depression.
Okay.
Yeah.
And your father, has he had any medical issues?
Yeah, he had prostate cancer. He had that removed.
Yep, so he's in remission?
Yeah. No, he's not in. I'm not sure if how long. Well, it's been past the remission period.
Okay, so when did he have that?
It would have been 3 years ago.
Mm-hmm. Do you know much about your grandparents?
Yeah.
Yep. So on your mother's side, your grandma and your grandpa?
On mother's side, her mum had a heart attack.
Mm-hmm.
We suspect she had angina before that.
Yep.
The doctors in Tamworth don't diagnose anything properly in the country. And then her husband got cancer from the crop spraying, and he was misdiagnosed as well.
What about on your paternal side, grandma and your grandpa?
What, father?
Mm-hmm.
Pop died of prostate cancer. And then was dementia.
Okay. And do you have any siblings?
Yeah, 2.
Have they had any issues? Any medical issues?
No, I think Hugh gets a urinary tract infection sometimes.
Mm-hmm.
No, nothing really like a disease or whatever yet.
Okay, so in general, how would you describe your health? Do you have any weight changes lately? Weakness or fatigue?
I think my health is pretty good. I just need to cut down on my alcohol intake, and last time I had a health check, my cholesterol was going up a little bit, so I've got to watch that.
Would you experience fatigue?
Yeah, sometimes. Yep, just being overtired. Yeah, fatigued. Yeah, in the afternoons usually.
Okay, usually. Okay. How would you rate your energy levels out of 10?
So it depends. In the mornings high, but then in the afternoons quite low. So in the morning, I might have 5 to 7, and then in the afternoons I might have sort of 3 or 4.
Okay. So for your sleep, when do you go to bed?
At about 11.
11? Till when?
7.
Yep.
Or 7:30. Yeah.
Is that every day?
Yeah.
Do you have trouble falling asleep?
It's only if I'm stressed or my tinnitus is bad.
Mm-hmm.
Yeah.
Would you say your sleep is deep, light, or undisturbed?
It's light.
It's light, is it?
Yeah, deep. It depends. It can be deep or it's light as well sometimes.
Okay, so it depends.
Yeah.
Okay, so do you wake during the night at all?
I've been waking up at 4 in the morning.
4 in the morning?
You might want to pause it just for a sec.
That's fine. So in the morning?
Yeah, I've been waking up at 4 in the morning.
Has that been every night?
No, not every night, but some nights. I don't know why.
Has it been going on for a long time?
Yeah, I think it's due to alcohol.
Okay.
It's mainly if I drink. And I haven't done much in the day except worked.
Mm-hmm. Would you say you wake up feeling refreshed generally, or
not? Not if I have woken up at 4 in the morning. No.
And do you have dreams?
Yeah.
Are they good or bad? Or
mostly good dreams. Good?
Yeah. Are they recurring? Ever?
Not generally. I mean, I have a recurring dream about not doing well in exams or not studying enough at school.
Okay. And do you snore?
Just when I'm falling asleep, I do. Yeah.
Okay.
Or if I drink.
Yep. If you drink. And then, do you exercise at all?
Yeah.
What type of exercise?
Martial arts, usually. Aikido.
Aikido, yeah. How often?
Twice, 2 or 3 times a week.
And then how long does that go for each time?
An hour and a half. And I also do riding and
bike riding?
General bike riding and general body weight fitness like push-ups and sit-ups.
How often would you do the bike riding?
Once a week.
Mm-hmm. And the chin-ups and stuff?
At least twice a week.
Okay. So your general quality of life, your stress levels, are you stressed at work?
Yeah, I can be stressed at work.
Yep. Okay.
Work can be stressful.
Yep. So on a scale of 1 to 10, 10 being the most stressed, 1 being the least, would you say it's...
If it gets really busy, it can be 9.
Mm-hmm.
Yeah.
And how about relationships and family? Do you get stressed?
I get stressed about relationships, yes.
Yeah. Would you say that's on 1 to 10? How bad would that be?
Usually it's in the middle, but it can be pretty stressful.
Mm-hmm.
Because I have had a separation, so...
Okay.
Yeah.
When did you have a separation?
Last year.
And then how would you rate your current stress levels?
I was sort of a bit higher sometimes.
Yep. So how high would you be?
Oh, like 6 or 7.
Yep. Is there anything else you'd like me to know that we haven't already discussed?
No, I mean, I wouldn't mind just on just like general food, just good food to eat, so I don't put on weight because I'm trying to lose a couple of kilos.
Yep, 2 kilos. By any particular time?
I just don't want to do it in the next few months.
Okay.
Yeah.
So what we can do is move on to your diet. So for breakfast, what would you generally eat?
I generally eat muesli and yogurt and fruit.
Yogurt and fruit. What sort of fruit?
Just tinned fruit.
Tinned?
And then I have a banana and usually a banana and a mandarin in the day.
Okay. Morning tea?
I don't have morning tea.
Lunch?
Just sandwiches or a bought lunch, which could be pretty much anything, but it usually has salad and vegetables in it.
What do you usually have on your sandwiches?
Just ham, cheese, tomato, and lettuce.
Do you have anything like mayonnaise or butter or
Yeah,
anything like that?
mayonnaise or mustard. Yeah.
Mayonnaise, mustard. Yep. And afternoon tea?
I don't have that. Or
Dinner?
maybe a muesli bar or like a piece of fruit, maybe.
Dinner?
Dinner would be usually some type of meat and vegetables, but
And
lean, like just not a. I'd only have a steak probably at the most twice a week, but usually once a week. I'd have something that's heavy and red meat.
okay. Are your vegetables steamed or stir fried or?
Usually steamed or stir fried. Yep.
Okay. And for supper?
I don't have that.
Yeah. Are there foods that you crave?
I crave chocolate
Yep.
sometimes.
Yep.
If I'm tired or stressed, I crave chicken burgers,
Yeah.
Portuguese chicken burgers. But if
Yeah.
I'm hungover, I crave fatty foods like chips and burgers.
Okay. Are there foods that you avoid?
Yeah, I don't usually eat fast food.
Yeah.
And I avoid. Yeah, no, there's certain things like eggplant. I don't eat eggplant, but nothing major. There's nothing major. I don't eat really meaty foods, like I don't know, spaghetti bolognese and nachos and things like that.
Okay. So, how much of the following would you have per day? Sugar? How many teaspoons do you think you would have the equivalent of?
2 or 3.
Do you have any tea?
Yep.
What type of tea?
Just Earl Grey or English breakfast. Usually 2 or 3 times a day.
With milk?
Yep.
Coffee?
Once a day normally in the morning.
What type of coffee?
Just a flat white.
Sugar?
Yep, I'm sure.
Any fruit juice?
Yep, I have fruit juice every day.
How much? And what type?
Usually like 1 or 2 glasses of apple juice.
Apple. Okay. Do you have herbal teas?
No.
Soft drinks or cordials?
I have a Coke maybe every few days.
Yep. Do you have any filtered water?
Yeah, I would drink filtered water at work.
How much water do you think you drink a day?
Well, at least 1.5 litres.
Yep.
1.5, 2 litres, yeah.
Okay. Now, are you on any current medication?
No.
Any current supplements?
I just have multivitamins every couple of days, and I usually have a vitamin C every day.
Mm-hmm. Do you smoke?
No.
No. Do you drink alcohol?
Yep.
How much would you drink?
Probably 3 glasses of red wine.
Yep.
Almost every day.
Yep.
But yeah. And then I try and have 1 or 2 days off, but that doesn't always happen.
Okay. Do you have any recreational substance use?
Very rarely.
Okay. Have you had any exposure to farm or industry chemicals?
No.
Are you willing to take any supplements?
Yep.
Okay.
Yep.
Okay, great. Now, okay, so looking at your symptoms and reviewing your body systems as well, you've mentioned you have hay fever and that you take, you said you take Telfast when you have particularly bad symptoms.
Yeah.
I would say the probable diagnosis would be that you do have hay fever, because it's seasonal for you as well, which is typical of, they call it seasonal allergic rhinitis. But then you also get it during the year as well, so that they call that perennial allergic rhinitis. And the triggers are very, very typical of hay fever triggers, like pollen, cat and dog fur, dust, certain flowers, etc. The probable diagnosis, though, we probably have to look further into your immune system, and maybe supplement you with vitamin C every day, because you might actually be experiencing influenza, and your immune system could be quite low from the stress that you're experiencing. The other differential diagnosis could also be that you actually have an allergy. The allergy could be to alcohol, because the symptoms that you're experiencing, although they're very, very typical of the hay fever symptoms, they're also typical of an allergy to histamines. Histamines are found predominantly in red wine, which is what you drink nearly every day. So in that case, there could be kind of a way that we'd have to look at a way to decipher whether it was hay fever or a histamine allergy. So what we could look at doing is supplementing you with more vitamin C. Vitamin C will actually act as an antihistamine in your body as well. So we'd probably up that to about 2,000 milligrams a day, and you'll find that you might not react so badly to the triggers for your hay fever. Now, you drink alcohol every day. Alcohol actually depletes vitamin B from your body, and vitamin B is where your stress is kind of managed. So probably a good idea to introduce 2 alcohol-free days and also supplement you with vitamin B. That will really help with your stress levels as well. I'd say they'd probably be the main things to start with. Spirulina is also another really good supplement that can help with your hay fever symptoms and your general health as well. So you might just generally feel that if we supplement you with these, you might feel that you sleep better, you might have a bit less stress, and your hay fever symptoms might not be as bad. So we'll probably do that for now, and then we can follow up maybe in a month's time and just see how you're feeling. Okay, thank you.